Hello, welcome class.
I'm Noemi.
I'm Shauna.
I'm Shannon.
And I'm Tyler.
And we're Group 4.
The following presentation aims to teach you more about the drug, furosemide.
Let's get started.
Drug classification. Furosemide, more commonly known for its brand name, Lasix, is pharmacologically classified as a loop diuretic. The therapeutic classification is heart failure and hypertension. Next slide.
Furosemide is used to reduce moderate to severe fluid retention associated with heart failure, hypertension, hepatic cirrhosis, and chronic kidney disease. Next slide.
Furosemide available forms. On the top left corner, we can see a picture of 2 Lasix tablets. Here we have 2 40 milligram tablets. However, this medication is also available in many other dosage amounts. It is also available in a solution form, such as in oral drops, injections, and IV bags. Next slide.
Tablets range from 20 to 80 milligrams and may be taken by mouth in a single or multiple doses throughout the day, depending on the indication. For more emergent issues, Lasix may be administered by IV to allow for a more rapid onset. Intramuscular injections are also used in rare occasions. The daily dosage of furosemide should not exceed 600 milligrams per day. Older adults may require lower doses. Next slide.
Furosemide acts on the ascending limb of the nephron loop, blocking sodium from being reabsorbed. Inhibiting sodium reabsorption leaves potassium, chloride, and water to attract the blocked sodium, following it along to the collecting duct and out into urine. By blocking reabsorption in the ascending limb, loop diuretics prevent more reabsorption from taking place, making them more potent than other classes of diuretics and the most efficacious diuretic currently available. For immediate relief, IV furosemide's quick 5-minute onset, 15 to 20-minute peak, and 2-hour duration are ideal. In contrast, oral furosemide achieves a peak concentration slower with a 30 to 60-minute onset and average peak after 60 to 70 minutes with a longer 6 to 8-hour duration. Nursing note, furosemide's absorption is slower than normal in patients with edema, chronic renal disease, and/or decompensated heart failure. Next slide.
Here we have listed the most minor and serious adverse side effects of furosemide use. They are all significant, but the most important ones to note are orthostatic hypotension and electrolyte imbalance with emphasis on potassium, since these are the most common occurring with its use. Due to increased fluid and volume loss, the patient's blood pressure would be lower but can become too low, thus the patient would be at a higher risk of falls or syncope, so you'd want to ensure that they are aware of this and to sit up slowly each time from a lying position. Risk of electrolyte imbalance due to excreting high levels of potassium could lead to hypokalemia and other heart-related side effects such as muscle cramps and weakness, palpitations, and fatigue. These symptoms would definitely warrant immediate medical attention for further evaluation. Next slide.
Here are some key points to remember before administering Lasix. Aminoglycosides should not be given due to the potential for nephrotoxicity and ototoxicity. Also, the herbal supplements hawthorn and ginseng alters the effectiveness of this diuretic treatment.
A high sodium diet should be avoided. Some other drugs that include should be used with caution while receiving Lasix treatments, including corticosteroids, aspirin, digoxin, and other medications listed in this section to the right.
Contraindications include hypotension, hypovolemia, anuria, pregnancy, and breastfeeding. Lastly, this medication has a black box warning due to its potential for severe fluid and electrolyte loss if given in excess.
Now sit back, relax, grab your urinal, and enjoy the following nursing application video. Hi, Noemi. Who do we have here today?
We have Edward, 52 years old, presenting with bilateral edema, hypertension, and history of diabetes. He was admitted 2 days ago with chest pain.
Good morning. My name is Nurse Shannon, and this is Nurse Noemi. Can you tell me your name and date of birth?
Sure. Edward Ryan, March 8th, 1970.
Thank you, Edward. Do you know what you are here for?
Yeah, my legs swelled up like water balloons, which happens a lot. This time felt different, though. My chest was hurting too, so we called 911.
The doctor said his hypertension has gotten worse. What is this new medication they started him on?
Because his heart was under so much strain, he has been placed on a medication named Furosemide, also called Lasix. This medication acts in the kidneys to relieve fluid retention and take strains off the heart to get his blood pressure down and reduce swelling in his ankles, legs, and body.
They have been giving him those meds since we got here. He's been getting up to pee a lot, though. Is that normal?
Yes, it is very common. The swelling is due to a buildup of fluid in his extremities. The Lasix is working in your body to remove excess salt and water to take strain off your heart, producing more urine, causing you to feel the need to pee more. The most important thing to remember is to get up very slowly from bed or from while seated. Trying to rush to get up too fast on this medication could leave you feeling dizzy or lightheaded and may lead to falls.
I have been feeling dizzy. They just gave me a dose an hour ago. How fast does this stuff work?
Lasix takes 30 to 60 minutes when taken by mouth to kick in and lasts for 6 to 8 hours. Since you have been feeling dizzy, we can practice getting out of bed and going to the bathroom. Make sure there is nothing blocking the way to the bathroom. Keep it easy to access.
Keeping a urinal at your bedside is a good option for nighttime urgency too, especially while getting used to Lasix. Other common side effects you could have with Lasix include fatigue, nausea, and/or diarrhea.
Check with your doctor right away if you are having dry mouth or increased thirst. Ringing in the ears is also a red flag to give us a call. If you are having muscle cramps or weakness, you should notify the doctor.
Also, a normal respiratory rate is 12 to 20 breaths per minute. If you count less than 12 breaths over 1 minute, seek medical attention. It's helpful to watch for the rise and fall of his chest if you're having trouble seeing the breathing.
This medication may cause your blood pressure to drop. If you have a way to monitor at home, keep note of your blood pressure in a journal. It can help keep track of it if it's dropping too low.
I have a cuff at home, but how low is too low?
90 over 60 or lower is too low.
Okay, but how will this medication react with my diabetes?
If your blood glucose is consistently elevated, check in with your GP. You will need to monitor your levels more than normal until you know how this drug will affect your body.
I organize our pills. At what time should we give him his medication?
Edward will take 1 pill twice daily with plenty of water. Taking the first dose early in the morning allows for evening dose to be earlier. This may help prevent getting up too much in the evening.
As far as diet goes, what should we adjust?
We recommend adapting to a low sodium, low salt diet.
Also, with all the water loss from Lasix, you lose a lot of potassium and other electrolytes. To offset this, you need to hydrate well and eat foods high in potassium.
Do you like banana?
Yes, I do.
Fabulous! Bananas, orange juice, raisins, dates, and avocados are all great options that are high in potassium. I have a brochure for you to take home that covers excellent diet tips. You'll receive it when you get discharged shortly.
It seems like he's been getting lots of blood work here. What are they looking at?
Well, this medication requires routine monitoring. Checking his levels is just one way of making sure the drug is working properly. We are keeping an eye on his electrolytes, making sure his kidneys and liver are okay. Another way to see if the medication is working well is to check those legs or ankles for swelling.
We know how to check by pressing the swollen area and see how long it takes to not show an indent.
Exactly. Do you have a scale at home?
Yes, but it's hid in the basement after Thanksgiving, though.
You will need to weigh yourself every day at the same time, preferably. Please be aware, however, if you gain or lose more than 2 pounds in 1 day, please report it to your doctor right away. This medicine may make your skin more sensitive to sunlight. Use sunscreen, wear a hat, and protective clothing when you are outdoors. And remember to avoid sun lamps and tanning beds.
Edward, this medicine will not cure your high blood pressure, but it does help control it. You must continue to take it as directed if you expect to lower your blood pressure and keep it down. You might have to take high blood pressure medicine for the rest of your life. Lifestyle changes such as maintaining optimal weight, avoiding alcohol, reducing cholesterol and saturated fats, eating lots of fruit and veggies, not smoking, and increasing physical activity will help.
Do you have any questions before we go?
Yeah, when can I go home?
Looks like you'll be ready to be discharged soon. I'll check with the physician and get your paperwork started. I'm going to leave you with this brochure to help you with all of the information we just covered.
It's a lot to take in at once and can be overwhelming. Asking for help isn't always easy, but letting family or friends in on your health is important.
Thanks, nurse. We will let the kids know what's going on.
He means I'll tell the kids how they can help.
Informational brochure. This is a brochure that was presented to our patient Edward in the video clip. Let's take a closer look of the content. Next slide.
As discussed in our video, this is the informational brochure that was provided to our patient to have for reference while adjusting to his new diuretic drug therapy. It provides important guidance for patients started on furosemide to ease with the transition. It has listed items for patient teaching and, as I discussed earlier, some common side effects a patient would want to look out for, as well as when to seek medical assistance based on these listed symptoms. Next slide, please. Continuing with the back of the brochure, it provides several key items to know, from the most common uses of furosemide, the different route and dosage options, and the ways it can be taken, to the potential interactions a patient would need to be aware of between Lasix and other drugs, as well as with herbals and foods. Lastly, we have a wellness section that offers some diet recommendations, things to avoid while on the medication, and some non-pharmacological ways to improve his condition. Next slide, please.
Thank you for listening to our presentation. Any questions?